Case 5. This is a boy who presented with diarrhea, fever, and abdominal pain. 10 days fever, abdominal pain, diarrhea, toxic ileus, counts are normal. We always, today or any day for that matter in India, we always think of typhoid fever. So we started on ceftriaxone. In spite of that, he didn't improve. He had very severe abdominal pain. Cultures, including stool culture, was negative. Occult blood was positive in the stool. And on day 11, he developed an oral ulcer and he complained of pain in the eye. We didn't know what to do. See, this looks like intrigue, but he's not responding to antibiotic. He's developing oral ulcer. The moment he had abdominal pain and oral ulcer with diarrhea, we thought it may be non-infective inflammation of the bowel rather than infective inflammation of the bowel. We started thinking beyond infection. And next day, on day 11, he developed classic erythema nodosum like this. And he developed eye pain, and our ophthalmologist promptly diagnosed it as uveitis. We didn't know whether this is tuberculosis, which is causing erythema nodosum and uveitis, or whether it is an inflammatory bowel disease. So we did a stool calprotectin, which was more than 2,000. Colonoscopy was done. It confirmed Crohn's. Okay. And he was treated with steroids and methotrexate. This boy is on adalimumab for the last 10 years or so because he had severe uveitis. He is in remission. And what we must remember that abdominal pain and you have fever, you have erythema nodosum. Erythema nodosum is a hypersensitive manifestation of tuberculosis. It can occur in drug hypersensitivity, it can occur in collagen vascular disease, can occur in SLE, polyarteritis, any condition can cause. It can occur in tuberculosis also. So it's always a DD for Crohn's disease. Okay. And many a time, these patients have some mesenteric adenopathy where there is a tendency on the part of pediatricians to overdiagnose tuberculosis and miss Crohn's disease. And here, what is important is to look for extraintestinal clues. It's very unusual to have uveitis in tuberculosis, right? And, such high calprotectin level, erythema nodosum, occult blood positive, you don't have any other diagnosis other than Crohn's disease. The other important point in Crohn's disease is that Crohn's disease, though it is an inflammatory bowel disease, ESR may be high. And if the disease is involving only the ileum, CRP will not go up. Like SLE, many a child with Crohn's disease may not have elevated CRP. Okay.